ladies and gentlemen, welcome once again to the Think Clinical Podcast. My name is Hamza. It's amazing to be here once again, and today's episode is going to be very, very, very interesting because we'll be looking at how to understand the mindset of the patient. You're a healthcare entrepreneur. The patient is your customer, is your buyer, is your partner in this business. In order to be able to serve them better, how do you understand their mindset? How do you get into the point where they trust you enough to stay with you through thick and thin and make things happen? How do the patient really think? How do they think about you as a business partner? How can you shape the mindset of the patient as far as your business is concerned? These are the things that we'll be looking at the key points. And again, if you haven't done so already, please remember to subscribe, like, and share so that you get a notification anytime this comes up. But when you look at some key points on what the patient mindset is, first of all, there has to be some component of emotional drivers. So patients either come to you because there's some fear of what they don't know is wrong with them, or they feel vulnerable. And they also need hope. So what you do is that when you have patients, first of all, and these are key points that you need to understand, there has to be some emotional drivers to what you give patients, and seeking what they are looking for most of the time when they come to you in fear, very vulnerable, they are hopeful that you can help them. You need to make sure you reassure them. You are not there to just give them solutions and tell them exactly what to happen. You need to be very reassuring. That's the first thing. And you need to look at trust barriers. So trust, 68% of healthcare or patients distrust healthcare ads. So if you make healthcare ads, almost 70% of patients they don't trust it. So when you are building trust, authenticity is non-negotiable. So that has to be another thing that's in your mind. And then you have to look at the information paradox, where you don't overwhelm the patient with information. You have to provide clarity, because that's what they crave. So when patients go on Google, there's a lot of information. We call them Dr. Google. They provide so much information, but without clarity, so patients get overwhelmed. So these are the three key things I need you to look at before we start jumping in. So how do you understand the mindset? How do you decode the mindset of the patient? First of all, you have to do the empathy first funnel. That's the first thing. And when you look at this, it's in 4 stages. You have to look at the awareness stage. And this is the awareness stage. So if you're doing the empathy first funnel, and you're looking at it from down, and you have a funnel, you are going to first of all start from an awareness, and that's where you are creating, you are educating people through blogs, through webinars. You are addressing their fears, because you know the things that they are afraid of. Share common symptoms with them, share FAQs, make sure people really understand what they are talking about. The second thing is the consideration stage, which is part of the empathy first funnel. And you are building, so when you're doing the consideration stage, you are building trust with patient stories and transparent pricing. So what they are saying is that the patient is going to now be the one to advocate for you and tell everybody how safe you are and how good you are, and how and reassure people that they can actually work and trust you. So that's the consideration stage. And the third stage, the decision stage, which is the offer guarantees to reduce anxiety. So letting people know, hey, we have short waiting times, we respond to calls, we will get back to you, we care about you. So those things are important for people to be able to gain the confidence that they need to be able to work with you. So again, you have to go through the empathy channel if you want to decode the mindset of the patient. You have to first of all go through the awareness stage, where you are educating people through blogs, social media, and all that you can have. You need to go through the consideration stage, where you are building trust with patient stories and using transparent pricing models to make sure people understand what is going on. And you need to go through the decision stage, where you offer guarantees and you're able to reduce anxiety for patients. Secondly, now just to emphasize on this, please remember you always have to use the 80-20 content rule, which is that 80% of your content that you share with your patients has to be educational, and the other 20% has to be promotional. So when you err on the side of promoting your practice more than being informational, it's going to be a problem. So you have to spend 80% of the time being educational and just 20% being promotional. Now, when you start, the second thing you have to start looking at when you're talking about patients after empathy is to build trust through what I call the trust equation. And the trust equation has 4 components. So when you're looking at trust, you're looking at trust on 3 things. Patients build trust with practices or with healthcare businesses based on credibility, which would come in the form of them walking into your practice, seeing credentials of the doctors that they're going to be working with displayed, giving them the assurance that I am coming into a practice or a healthcare facility that has trained medical professionals and this is what they are or who they are. And then that's the credibility one. So trust is credibility, and you have to add reliability because you're consistently communicating with these patients. You're sending them appointment reminders. They're sending them reminders to pick up their medication from pharmaceuticals. They're sending them reminders of the very common awareness, health related awareness items that they need to know. They need to be reliable. They need to be able to call and they need to get you. That's the mindset of the patient. And the third component is intimacy, because when you send personalized emails instead of email blasts to all patients, it feels different. So if a patient gets just a text message even from their doctor, they feel very, very special and they feel different. So when you add credibility to reliability to intimacy, that is a good positive way of building trust. But what you don't want to do is to minimize self-orientation. So you need to avoid salesy language. Stop sounding like a salesperson in healthcare. You need to focus on patient outcomes. So patients do not want you to be salesy with their health. They want you to be focusing on what the health outcomes are, so that they don't feel like you're trying to sell them a product. So again, building trust is reliability plus credibility plus intimacy, and you can divide all these by self-orientation and you have your trust. Right now, this is my way of thinking about trust, about how patients build trust with the healthcare providers. Now you have to also make sure that in building and getting to decode the mindset of the patient, you have to look at the patient journey and personalization. What does this mean? Your first digital impressions are very important, so you have to optimize Google My Business with FAQs, things that patients don't need to contact you for again. They already have the material, so they just use it. They just get their answers without you going to. So you have to optimize that. You have to provide pre-visit comfort, which is something like sending an email or what to expect to help reduce anxiety, because sometimes it's very scary for a patient, especially those who don't go to hospitals regularly, to just get up and come to a hospital without knowing what to expect. So when you send what to expect videos, they are very helpful in those circumstances. And then post-visit engagements, which is you are following up after their visits. And AI chatbots have become very instrumental for following up with patients, sending medication reminders, sending post-visit surveys. They are really important in engaging the patient after the visit. So you have to look at this, the journey from your digital impressions all the way to your pre-visit comfort and then the post-visit engagement. And now let's look at some demographic nuances. When you are looking at patients, you need to also remember that we are looking at patients in different generations, and these people and these patients respond to different ways of communication. So Gen Zs, for instance, will respond to, they would rather prefer having a telehealth consult because that is the generation they grew up in. And they would like to have Instagram Q&A sessions. It would be fun for them, right? But if you look at boomers, a boomer would require you to pick up the phone and call them, or worst case scenario, send newsletters, right? So you have to look at the demographic of patients you have and tailor out the communication strategy that will help you with them. And then the last thing is that you have to avoid pitfalls and tech integrations, which means that when you start ignoring emotional cues, then it becomes a problem. As a dentist, you are drilling holes in somebody's tooth, and you are not even looking at the cues of what the office looks like. Is the office calming enough? Does it offer safety? All the technology you are putting around this patient, does it make them comfortable? You need to make sure you are on top of these, and do not overpromise outcomes. So patients do not want you to overpromise outcomes, and you don't have to overpromise outcomes. And the last bit of this that we need to look at is that stay in touch. Any patient who feels like they are being listened to, whether it's an AI chatbot or a person, is very important. Making sure that you have 24/7 chatting availability to patients gives them a lot of assurances. So these are the things that you need to start looking at if you are thinking about how to decode or what the mindset of the patient is looking like. You need to look at empathy first, go through the channel first, create awareness by educating them, make sure that you build trust with other patient stories, so that patients know other patients are vouching for you, and make the decision stage just offering guarantees. And then going through building trust with patients, as well as personalizing their journey through the clinic, and actually looking at the demographics you have and what the effective communication channel is. So hopefully this has been helpful to you, and this has been another episode of the Think Clinical podcast. Thank you so much for joining us, and we will see you in our next episode.